Hi, and welcome to our MedStars podcast, where we have credible conversations about healthcare. Today, we're joined by Mari-Carmen Sanchez-Morris, a former paediatric intensive care nurse and founder of Matresa, to discuss the maternity care crisis and how better education, early support, and employer action can help mothers through pregnancy, postnatal recovery, and return to work. Hi, Mari-Carmen. Really pleased to have you on our podcast today.
Thank you for having me.
It sounds very exciting, your project, Matresa, but let's start at the beginning and just tell me about your journey, about starting as a paediatric intensive care nurse and then motherhood and then founding an amazing company.
Crazy. Yeah, some would say that. I started my career as a paediatric intensive care nurse. I went to QMC in Nottingham to do my nursing training and then got my first job at the Children's Hospital, which
In Birmingham.
In Birmingham, where
Yeah.
you work. I don't remember seeing you there, though.
I think we must have
We've
crossed
just
paths.
passed. And I worked there for 7 years looking after very poorly children, and I loved it. However, I always remember coming home to my husband wanting more. I think I've always had very much of an entrepreneur mindset, and then it wasn't until I had my first child, who is now 9, I went on maternity leave and had quite a traumatic birth, ended up having a C-section under general anaesthetic and couldn't find the support I needed postnatally. So I set up my first company in health and wellbeing, supporting mothers with their postnatal health and fitness, so pelvic health, diastasis recti, and built that company over the 7 years, went on to have 2 more children. And it was in that journey where I really found that my story wasn't in isolation, and sadly many mothers are failed by the health system and also when they return back to work. So that's where Matresa came from, really.
Wow. Do you think you needed to be a nurse first to understand what you went through to then make that next step?
Yeah, because I think that has given me the clinical credibility, but also understanding, even though it was paediatric services, a lot of the things we see in the system is quite common across all areas within the NHS. And then my own journey was actually what then sparked it, that traumatic birth. And I think that's added to, the understanding of the problem, because I went through it firsthand, both clinically working as a nurse, but also as a mother to 3 children.
Lots of people have gone through quite stressful, traumatic births.
Yeah, sadly, yeah.
But not many people then move on and set up businesses to try and solve that problem. What was the sort of light bulb moment that sort of made you say, right, I've got to do something about this. This is more than just an experience to me. This may be an experience that other women might have.
Yeah. It was through obviously setting up my first company and then doing a bit of research around what is given to mothers to support them, and out of clear frustration, the sense that there are lots of femtech maternal health companies out there, but nobody is connecting all of the dots. And I think in order to support a mother through motherhood and families, we need to understand what's going on at home. So, is she married? Is she a single mother? Has she got a partner? Whereabouts in the country does she live? In relation to, we all know that it's, unfortunately with maternity services, it's very much a postcode lottery. So what access to healthcare does she have? And what does she do at work? Does she work in the public sector? Does she not work? Does she work for a company whereby she's got private medical insurance? And bringing all those 3 things together to be able to solve that problem. Whereas at the moment, everything is in silos and nobody's talking to each other. And I think that is why we still have this problem that it is today.
Yeah, right. There's something about doing something, and there's something about timing.
Wow.
Isn't there?
Yes.
And Donna Ockenden, she's done some fantastic work, formerly in Shrewsbury and Telford, but then more recently in the Nottingham universities, looking at maternal health outcomes for babies. And she's just released her main report in 2020, just a few months ago. And it's quite dramatic. She looked at 2,500 cases. It's the largest review of maternity healthcare, and 520 mothers and babies had poor outcomes, sometimes causing death. And she sort of reviewed those factors. There are many sort of factors, but one of the key factors is mothers are not being listened to. The warning signs are not being seen. And sometimes no matter what project you do, this seems to be the time to have a greater sort of information and some sort of system
Yeah.
from others. When you read that report, what did you come away with?
Yeah, well, I wasn't surprised, which is very sad. And actually, a lot of the findings that she found are the same as the other reviews that she's done.
Yeah.
And I think it is great that we've got these reports, the same as Baroness Amos has obviously done her national maternity review. But we need to have action. It's all well and good doing a review and reports and recommendations, but there needs to be accountability. And interestingly, with Donna Ockenden, there was quite a few members of staff that didn't actually come forward to share their findings. And James Murray actually at the moment is looking at whether these professionals are going to have to come forward to share their findings. I think now is, it's a lot of the findings are around fragmentation, like you say, mothers not being listened to. So many different trusts are doing different things. You could one mother could say that she had a great experience, but then another mother would say that she didn't. I think there has
even
to be,
within the same institution as well.
Yes, yeah, there has to be consistency, and I think we have to learn as well from the trusts that are doing a really good job. In London you've got St Mary's, and then you've got the other hospitals as well there, and that we all need to be working together and learning from the trusts that, okay, well, they're doing good at this, we're not doing so well in this, let's talk together and work together. So but that doesn't seem to happen.
No. And I know that it's sort of easy to say there's good trusts and bad trusts, but I think when I've talked to people in different trusts about this and go, what do you think, and the common sort of reply that I get is that people go, well, it could have easily happened in our institution too. And and I think there's a sort of systemic sort of almost a sort of nationwide problem, rather than just blaming one or two institutions. I think it's a much wider problem in the whole structure of how healthcare is delivered.
Yeah, and I think the government have to have some accountability with this as well. And like you say, it's the infrastructure, it's how it's set up. I think it requires an absolute overhaul. And interestingly, I didn't know whether you knew, but they had a maternity safety budget that was 96 million that was slashed to 2 million in 2025.
Oh my God.
So, a lot of these recommendations that they are suggesting, you and I both know as health professionals, it needs to have the funding behind it to be able to deliver on these.
Exactly.
You've got to have the money behind it. And without that, I struggle to actually understand how they're going to do it. And it starts with the staff. You've got I feel very sorry for a lot of midwives, to be honest, and also obs and gynae consultants, because they are getting a really hard time. Obviously, there are a few that aren't so good. I remember when I was in my nursing days that I come across some professionals that, however, on the whole, you've got
most people go into nursing,
they do
medicine to do a good job.
Exactly.
Everyone, that's the starting point, and then it's the environment that they're in, the culture that they're in, the work pressures. And it can make people behave in ways that they never intended to in the first place.
And that's what I think needs funding. You've got to pay the staff properly. You've got to invest in their education and also retaining, you've got to progress them. Otherwise, midwives and nurses will leave. And also hours, the shifts they're working. If you've done the run of 3 days of 12-hour shifts.
Yeah, no amount of coffee is going to keep you
that's how mistakes happen,
Yeah. That's so. What does good maternity healthcare look like? How does, if you're a woman now going into the system, maybe you're pregnant, maybe you're listening to this and you're worrying about it, how do you sort of evaluate the care that you're receiving and understanding, am I being treated to a standard, or am I receiving good care? Because it must be very frightening for people to read in the press this situation, because it's not going to get solved overnight. And how do people navigate that?
And that's really sad that mothers now are entering what should be, if it's planned, obviously, an exciting time, and they're frightened because of what they're reading. I think for me, obviously, it is, as a nurse, I knew what questions to ask, and I don't that should not be that should not determine the level of care that you get, because how does a mother know
You're a
what good looks
professional
like?
patient, right?
Exactly. I was the doctor's worst nightmare because I knew what questions to ask. And if I wasn't happy with something, then I would be able to self-advocate. So I think there's an element of education here that should be aimed at all levels. It should be so it's accessible to everybody. I think so mothers have got the education so they can actually self-advocate for themselves in those situations. And for all types of situations, preparing them for things that can go wrong without scaring them. But also there needs to be a standardised approach. We've got to have a framework that is worked and adopted across all maternity trusts. We should all be working together across the same standards. And I think it shouldn't be postcode lottery. I've got some mums that tell me, well, my postnatal check was on the phone, whereas some mums will say, well, actually, I had an hour appointment with a doctor. There needs to be, everybody should have access to the same, no matter where they are.
Whatever's needed should
Exactly.
be sort of rolled out across.
Exactly.
What do you think of the warning signs? If I was just arrived on the delivery suite, what are the things that are sort of red flags that might?
Yeah.
Is it just the way people treat you, talk to you, or is there something more specific?
Well, if I think about my second pregnancy, so I decided to have a VBAC with Florence, purely
What's a VBAC?
So a vaginal birth following C-section.
Yeah.
So with Arthur, I had an emergency C-section, and that was under general anaesthetic. However, I laboured quite well. I went to Birth Listenings Line and spoke to a senior midwife and decided that for my second, I would try a vaginal delivery because it wasn't so much my body, it was more the fact that he was being a monkey as to why it ended up in that situation. So anyway, so I decided to go for this VBAC. I do think second time round, having a child is harder. First time round, you're blissfully ignorant as to what's going on. Second time round, You've got in
knowledge.
well, first time round, it was quite quick. Why isn't this happening second time round? But I will remember getting onto the maternity unit and it being a really, really, really busy shift. And I think I'd been in labour I'd had a sickness bug actually the day before. So I didn't have any sleep, got onto the maternity unit, and I think I was about 3 or 4 centimetres. And I was so tired. And I'd got in my head, I was like, well, I'm going to be awake now for 30 hours. I need some more pain relief. And I remember asking the midwife who was looking after me, can I have some pethidine?
Yeah.
And because my mum said, I had pethidine, it worked really well for me. And I should have known. But in that situation, I was like, no, because I have some pethidine. It will give me a bit of, respite. And then I'll be ready to go for when the contractions start. Anyway, she came in and she just gave it me.
Yeah.
And she didn't assess, she didn't look at, she just gave it me. And that was because it was a really, really busy shift.
And she just needed to do
and
it
she just needed to do it, and she just give it me. And that's when it went wrong. And that's when I then all the contractions stopped. It turned out to be, I ended up having a forceps, I tore, I had an episiotomy because it slowed everything down. Now, what should have happened was that if the maternity unit had been staffed properly,
there'd have been a conversation.
Exactly.
And an assessment.
Exactly.
And then maybe talk you through different options.
Exactly. And maybe that wouldn't have happened. She might have said, well, actually, you're now progressing. That's probably not the right idea. Let's try something else. But I didn't have that. Because
were you with someone?
My husband was with me, yeah. But she was really busy. Yeah. And I think it's interestingly, somebody said to me the other day, with a dog walker, they're only allowed so many dogs. A nursery, they're only allowed so many children to look after. Yeah, on labour wards, you've got midwives looking after,
Multiple
4 babies at one point in labour. It's just unsafe.
Yeah. It's interesting that because when you're in that situation as a woman, there's so much happening to you, and it might be completely new experience. It might be a repeat experience, but it's probably the person that you're with also needs to have that education just as much, because they're your advocate. Go, hang on, let's have a conversation about pethidine, because you might not be, there's the other pressures involved. You might be mid-contraction, and those conversations are quite difficult. So having someone spreading and sharing that information and sharing that knowledge with whoever's going to be with you is probably really important.
Yeah, absolutely.
Gosh. So how is your project helping people? What's the aim of Matresa, and who should use it? And why is it going to make a difference?
So if I describe it in layman's terms, so if you are a mother in the UK, you will typically, you'll have your antenatal care, which I would argue is better than postnatal care. You'll then go for your 6 to 8 week postnatal check with your GP. You'll be signed off as okay at 6 to 8 weeks. And then that's it. Off you go. And there's that period between, postnatal 6 to 8 week check to returning back to work. And we are continuously hearing there's a maternity crisis. We've got mothers with postnatal depression, 1 in 5 suffering from perinatal mental health. And with many mothers, 75,000 mothers not actually returning back to work. And nobody knows what's going on because nobody's collecting that data, that longitudinal piece. So we've developed a platform which is the interface for a mother, but it's actually the data model that we're building is the product. And that follows the mother's journey from pregnancy to the first 2 years. 2 years being because that is when a mother can actually show signs of perinatal mental health. It can be up to 2 years. And how it works is a mother will log into the platform. She will be asked to check in, and it will be looking at her biometrics, so heart rate, HRV, sleep, integrating with her maternity notes, and also looking at her symptoms in related to preeclampsia, perinatal mental health, and gestational diabetes. And we pull that into our data model, which is trained on clinical pathways. So we're able to recognise if a mother is going down a certain trajectory. And in the
earlier, perhaps.
Earlier. Because it might often be, a lot of the time, a crisis doesn't just happen. There's a series of events that have happened before that. So if we can recognise a mother potentially just needing a bit more education, then we can give her that on the platform, or we can refer her to the health professional that she needs at that right time before it becomes a much bigger issue. And that is all the way back to return to work. So for an employer, we support the mother by keeping her healthy and on that journey back to work. But also for the employer, we've built in intelligence layers as well, not sharing all the information of a mother all around the mother's readiness to return back to work.
It sounds almost like a research project in a sense.
Yes.
With obvious benefits for. So a mother would just sort of interact with it naturally. She doesn't, a potential mother or a mother, they have that normal interaction, but then depending on those interactions, depends on the support. Basically.
Yes, so it's all personalised and geared up to her. So how she interacts with the platform will determine on what she sees.
And so that's going to generate a rich database of understanding.
Yes.
Where people start deviating.
Yeah.
And that's where you're getting the early warning signs.
Yeah.
So you can help people earlier.
Yeah. And that data then becomes, really valuable because then we can, from a research point of view, obviously with consent from the mothers, but we know a lot of the NHS, a lot of the data, all of it is on men. Where's the data set for maternity? So if we can start to understand, you've got a cohort of mothers in Birmingham versus a cohort of mothers in London, well, what do those different cohorts need? And then we can support with, okay, well, where does the budget go? And those populational level insights, we can support with those as well.
That sounds fantastic.
Yeah.
It's interesting you mentioned employers because you mentioned an amazing stat there that people don't return to work after a year of returning back from maternity leave. A huge number of women leave work.
Yes.
I don't know what the stat is.
Yeah.
You can tell me perhaps.
Yeah.
Yeah, it's like 50.
So it's 75,000 every year leave.
Yeah.
And the cost of it is 650 million annual UK employer costs due to maternal attrition.
Yeah, so that's women who've come back after pregnancy, who spend some time at work,
yes,
who then go, this is not working for me.
And it's not straight away, it's within when they return. So interestingly, one of the big accountancy firms, within the first 2 years, 17% leave.
Yeah.
And I think that's where a lot of employers go wrong. They just see it as a one-off event. Oh, it's maternity leave, they come back, they get X amount of kit days, off they go. Whereas we need to support the mother in that reintegration bit. And we all know ourselves, when you first go back, it's a bit novel. But actually, 6 months back, when you've got children at nursery, children at school, your support maybe, you might not have the help of grandparents.
Yeah.
Then that's when mothers, partners really need that support when they are back at work, not just going back. It's, that integration back into the workforce.
I'd imagine most employers are quite well-meaning, and there's various policies, and they probably implement those policies well, but what are they missing? What's going wrong? Why are so many women leaving work when actually work is probably a very good thing? Because,
Yeah. I would argue that some companies do a very good job
Mm.
and some don't. The standard, again, is very different. But interestingly, if you look at what happened with menopause a few years ago, it was almost like a nice to have. We've got a menopause policy. Whereas now, companies have to report on that menopause policy. And what we're seeing now with maternity is the same. I believe it's going to go in the same trajectory, whereby companies will have to report on those numbers. And actually, by the end of this year, by January 2027, you are not allowed to basically get rid of a mother within the first 6 months. There's strict.
But I imagine mothers are giving up because
Yeah.
it's not the employer going, we're getting letting you go. It's women are giving up because the support's not there.
Yeah. And I think that's really hard because companies have obviously got a job to do. They obviously need, they need to make money.
Yeah.
So there's a fine balance. But I think it's also looking at the top down, creating that culture again, that leadership, ensuring that your managers are trained on how to support returning mothers and partners.
Yes.
Because we all know if you've got a good manager, then
fine.
you're going to be fine. But so if you haven't, then your experience may be very different.
Training piece.
Yes.
And other countries, I'm thinking of Sweden.
Well, they do a very good job.
Who do amazing jobs. And is there a big difference? Is there something that stands out that's like Sweden does that we don't do in the UK?
I think this is where government need to come involved. And I think that's why we are speaking to government, because they play a huge part. If you look at Sweden, their whole education system, childcare costs, it's much less. They get a lot of help. And I think that helps. Whereas in the UK, you've got nursery fees, so expensive.
Yeah.
You've got it's
and then
the
if you have
whole
more than one
infrastructure.
child, it
exactly. It's that whole infrastructure around it. And I think that's why you can't just, if you want to solve this problem, you have to look at what's going on at home. How can you support these families? Well, firstly, they should be given more affordable childcare. And fathers should be given more than 2 weeks paternity leave.
Yeah.
It should be much longer.
And it should be much longer.
Yeah.
I've got a friend actually in London who's just had a baby, and the partner has 6 months leave to support the mum.
Yeah.
And
exactly.
it's transformatory when you see them. They can be together.
Yeah.
They can take time together to learn.
Yeah.
It's a big life change, isn't it?
Well, it is. And you think, mothers are the ones that bring the next generation into the world.
Yeah.
And I'm like, this has such an economic benefit. And it's just so underlooked. Like if you keep a mother healthy, then that has benefits to the child as well. And that child is going to be also the next workforce.
Cared for children who grow up in healthy, happy homes, who can have enough food to eat. It's a massive difference, isn't it?
Yeah.
Wow. I just want to move on a little bit.
Yeah.
And I'd love to just understand your thoughts. You've set up more than one company.
Yeah.
Okay? And the NHS clearly has a need for services and entrepreneurship. And I'm just wondering what are the barriers of sort of providing innovative solutions to problems into the NHS?
Yeah.
And what are your thoughts on how that can be improved?
Yeah, it's quite frustrating actually, because my mission is to get this into the NHS, every mother to receive Matresa on their booking appointment with their midwife. However, they don't make it easy. And I think one of the biggest problems for technology companies like Matresa is the different systems. You've got to be able to integrate with not just one system, different systems. So there's that part. And also,
that's you talking about systems. You're talking about technological systems.
Yeah, so like EMIS, System 1. Okay. All the different systems the hospital uses, they don't just use one.
But I think there's more than one system, isn't there? Because it's like you think about one trust.
Yes.
And you think, oh well, the NHS is all these trusts together, but they're their own islands.
Yes.
Aren't they? So
yeah.
That's another.
Yeah. And I think that's a challenge for both innovation, but also why we see a lot of the issues that we have, because things just get lost because there's so many different, systems. So obviously there's that integration point, but also the red tape, the hoops you have to jump through. You
But
know,
there has to be regulation, doesn't there?
yes,
There's NICE, there's
yeah,
MHRA
yeah,
and all that.
yeah.
Those are important.
Yes, they are important, but I think sometimes um, it could be a bit easier to do. You know, for example, you've got so many successful companies that end up going to the US because because they've given up on the NHS because it just takes so long. You know, and at the end of the day, they have to make money. A lot of them have got investors. You know, they've got to make a return, so they decide to go elsewhere. I think the time it takes to get pilots into the NHS, it could be easier. And you know, although am I right in saying that now, they are helping that in the sense that if you integrate with one trust, they are making that easier in the sense that you haven't got to do the same process again.
Well, I don't know.
Yeah, I think I'm sure I read somewhere that they are making it a little bit easier in the sense you don't have to repeat that whole process again. Obviously, if it's a different technical infrastructure, fine. But in terms of getting into different trusts, it's making it a bit
innovation
easier.
hubs, aren't there, that can spread technology?
Absolutely.
quickly.
Yeah.
I was wondering whether the goals of the NHS. So there's a recent sort of 10-year plan for the future, big grand goals from central government. And I wonder how those goals translate into actual people deciding actions and developments.
Yeah.
I think wonder there's a disconnect, or do you feel that disconnect from the ultimate goal that the NHS is trying to do over the next 10 years and actually the implementation? Getting.
Yeah. I think there has to be, like you say, some improvements to that to be able to execute on those.
Yeah.
Because, you know, is it hospital to community, analog to digital? It's all, you know, neighbourhoods, hospitals, it's all great. But then there needs to be, well, how are you actually practically going to do that?
Yeah. And I think the cost is prohibitive as well. So lots of great ideas, young companies, new companies, entrepreneurship. But then there's a huge cost barrier to get into a large sort of organization and everything else. And the regulation is very expensive.
Yeah.
We're not like big drug companies with millions of pounds to get through regulation.
Yeah.
And so I wonder if there should be more support from central government to support small, great companies producing great tailored solutions.
Yeah, and like you say, investment, you know, because you've got Innovate UK, but I mean, that's a conversation not for online. I don't think they're probably the best company to talk about right now. But, you know, you've got NHRI, there's loads of grants out there, but I would argue not enough, and it's highly competitive. And I think one thing that I've found is that you can get some funding from Innovate, but it's a one-off project, but you've got to, and they don't see it through.
That's the problem with
you've
grants
got to
as
be
well,
able
isn't
to
it?
see it through.
Yeah.
You know, like if there's a company that's got this great idea, you've given them some funding, grant funding, and they've executed on it. Right, okay, well then how are you now going to support them get to the next level?
They get lost. All that great works get lost.
Yeah, and then it's a complete waste of money then.
Yeah.
There has to be that process. And we have just actually applied for an NIHR grant. And actually, if we are successful, they do support you right until you can be commissioned by NICE. And I think that's how a lot of these grants should be funded. If a company's got a good technology, they've delivered on the objectives, they are showing ROI, then they should be that journey should be supported.
I think I know what you're going to say, but I'm going to ask it anyway. I was going to say, if you could change one thing in the NHS to improve care to women, going through pregnancy and then afterwards, is there one thing that if you had a magic wand?
I think it'd be one system.
Yeah.
For maternity, we've got Badger, which is brilliant, but not all trusts use Badger. I think one system that not only supports the health professionals but also gives the mothers that education. I think also we've got the maternity task force that we've just been put in government now due to Baroness Amos's recommendations. I would like to see that the people on that task force are the obs and gynae consultants, are the midwives, the people that are on the front line actually delivering this service.
Patient representatives.
Exactly, to make sure that the solutions that they come up with are actually practical for what it's like to work in the health service. and just equitable care. You know, a lot of the time, maternity health tech companies, a lot of femtech solutions are great, but I would argue sometimes they actually make the gap even wider. You know, we've got to make sure that it can reach all the ethnic minorities, and also, you know, the people of lesser education, you know, all those
People
different...
who find it difficult to access healthcare.
Absolutely. And that's where the people that need it most.
Yeah. I think you had three. You had three wishes there.
Did I have... Okay, yeah, sorry. We can wrap it all into one.
And, but I forgive you.
Yeah.
And you're a very impressive lady doing fantastic things. I was
Thank you.
wondering if you thought back now and you could talk to yourself when you first started nursing, what would you tell yourself?
I've had no idea that I would go on to be an entrepreneur, to be honest.
Yeah.
I think I give myself a bit of a hard time. I'm not very good at speaking very kindly to myself, even now. It's something that I'm really working on. I think when you are in it and you're busy with children, it's very hard to see how far you've come. So I think if I was going back to that nurse at 21, it's just believing yourself and, you know, recognizing that my own worth and, you know, the talent that I have to be able to, you know, change, you know, provide impact, basically, whereas that's something that I'm not very good at.
Well, look, that's fantastic. Thank you so much for spending the time this morning.
Thank you for having me.
Thank you very much.
Thanks for listening or watching our latest podcast. If you enjoyed today's episode, give us a like, comment, or share with a friend or colleague. And to listen to more, head to our website, where you can also find out more about the work we do at MedStars.